Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend Colin Hung. The world of technology and healthcare are ever-changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news, meshed together in new ways which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. On today's episode, we're going to be talking about primary care and is our relationship with primary care dead? And be sure to follow the show on Twitter at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 16 years of health IT blog content at healthcareittoday.com. So, Colin, do you know your primary care doctor?
I am old school. I definitely know my primary care physician. Yes.
Yeah. Well, I don't even have one. I've tried a couple times and nothing really resonated. So I would say my primary care physician is a few doctors that are friends. So there's a bit of that. And then maybe the CVS or Walgreens Minute Clinic, whatever those are called now. I probably know them best.
See, so we're going to represent old school and new school because I fall definitely into the old school camp. I've had the same primary care physician since I graduated university. So
That's a long time.
yeah. Thanks, John. Thanks for reminding me how long.
I know my pediatricians for my kids, so there's something to say there, right? It's kind of like women know their OBGYN too, but yeah,
Sure.
Primary care, I don't know.
Yeah. Well, I mean, I definitely recognize that I'm in the minority now, where I go to the same physician. They know me, their office knows me. It's far away from my home now because I got this physician when I was living downtown in Toronto. But yeah, I appreciate it. And, it's great to have that, but it's more rare. And most people now are like you, urgent care clinics are fine. They go to the local clinic that's in the mall, right? Like,
Yeah.
that's all they need. And I think so. Yeah, right off the top, you asked, the comment you made, is the relationship with primary care physicians, is it dead? I would say, yeah, it's getting there.
Well, I mean, I find it fascinating that you still drive across town, passing hundreds of primary care physicians, right? To go to the one that you have a relationship with. And I mean, that just begs the question, are we going to do that still? Which on the one hand, telehealth could stop that and could extend the relationship. So in some ways, if your primary care provider offers telehealth, then that actually extends it because you're like, yeah, okay, if I just have to drive there every couple of years, that would make sense. But to do that every 6 months for checkups or whatever, yeah, I don't know. I don't know if I'm ready to do that. In fact, I tried it once with ZDog MD when he opened up Turntable Health, and I was like, nah, I don't really want to do this 20-minute drive to go to get my healthcare.
Yeah, I mean, first of all, in Canada, the dynamics are slightly different. There's not enough primary care physicians, and so you're lucky to have one that can regularly see you. But even if it wasn't the case, yeah, I recognize totally there are very good physicians that live, a few blocks away, or that have practices a few blocks away from where I live. Certainly can offer more technology-based visits than my current doctor does. But because I've been going to see them for so long, there is those extra questions that I feel and extra care that I'm getting that I might not get with a new person. Like they ask me all the time, hey, like, so what are the changes in your work, right? Like, are you still traveling a lot? Because that's if that's the case, we should probably be a little bit more concerned about your circulation because you're on an airplane a lot, and like the new doc, if I do have one, is probably not asking me that question until I complain about it. Right.
Yeah, that's what's interesting though. I mean, because that's where I was going in my head was like, what's the value of the relationship? If I'm relatively healthy, I get it if I have a chronic condition. I think that's kind of a different area. And maybe I'm just still in denial about my risk for chronic disease, which may be the real problem here more than it is, do I want a relationship with primary care? Is that I'm in denial and I feel pretty healthy. And I have a great relationship with my orthopedic surgeon because my knees suck, but I don't with my primary care because otherwise, besides breaking bones and old age and from sports stuff, I don't really care. And what would I even tell him anyway?
Well, see, and you've hit on something there that's interesting. Like you don't have a relationship with your primary care physician or a primary care physician, but you have a relationship with your orthopedic person, right? Because that's where you're getting, like, that's where you are getting hurt more, and that's more suited to your lifestyle. I think that's a difference in terms of the specialization and the regeneralization maybe that's happening where that's okay, right? Like, whereas before, I think the only gateway we had into care was you had to go through your family physician. Like, you had to start there, and they were the only way you got to anyone else. But now I think like your ortho surgeon or your ortho doc, they obviously care about you, they know you, and they've kind of got that relationship that a primary care doc would have had with you.
Yeah.
I hear that a lot, people from other people as well who have, better relationships with their OBGYN or with their pediatric kids doctor than they
Yep.
do with their
The
own. Yeah,
rheumatologist.
exactly. So, and I think that's okay. Like, and I think that maybe has taken away from the relationship that we all used to have with our primary care because that was the only doctor you saw on a regular basis.
Mhm. There's a couple angles to this. One is that, my orthopedic surgeon friend is a friend, and that's why I was able to hijack it. Like
Right.
I literally couldn't go and see him without seeing my primary care doctor if he wasn't a friend. And I
Right.
wouldn't go because it would be too expensive to go if he wasn't a friend, right? And so, but it's like, why did I want to hijack that system? Because I knew going to the primary care, he's just going to refer me to the orthopedic surgeon. So it's like, why am I doing this? It doesn't make sense. But on the other hand, there's a case to be made that if we want to lower the cost of care, an active primary care physician can actually do that if they do it effectively. I mean, I think we've seen that with Farzad Mostashari and his work with Alidade, in the ACOs, that an active primary care can actually be a big benefit from a cost perspective.
Yeah, I think people want to have a relationship with people who are providing them care. I don't think necessarily though that they want that relationship or that relationship has to be with a primary care physician, right? Whether you call them health coaches or wellness coaches, I think people do want a relationship with someone who understands their unique environment, their unique social economic status, their unique, lifestyle, and can make recommendations and check in and go, oh, hey, like based on what I know about you, maybe you want to stay away from the subway every 2 days, maybe want to try something else, right? Like that's kind of the stuff that I think can can happen. I think that people want that. So I think maybe it's not so much that we don't want to have a relationship with somebody in healthcare. I just think it's no longer only the primary care physician that is the only place where that could happen.
So let's talk about that. We want a relationship with some, with care, right? And then the question around, is primary care just this gateway to that other parts of healthcare? And I think maybe that's the problem with primary care, is that it was treated as just a gateway, and none of us like gateways, right? Like, I mean, at least here in the US, we hate gateways, right? It's like fundamental to our culture that we don't want to be gatewayed, and fundamental to everything that's changing in this world, right? Is like, no, you don't gateway me, right? There's a thing called freedom that we love. And, obviously some people take it too far in the wrong ways, but, we hate gateways. And if it's just a gateway, to me, that equates to bureaucracy. And we all hate bureaucracy too. And so I think maybe that's what's wrong with primary care, is it did just become a de facto gateway rather than something that really added value and actually coordinated my care and kept me healthy versus, oh, am I going to allow you to go see that specialist? Like, this seems so punitive and ugly, but yet that's kind of where we're at.
Yeah, I agree. I think in the past that it was primary care's main function, other than seeing someone on a regular basis, right? Like so if you were healthy and you just needed to go in for your 6 month, 12-month checkup, I think that's fine. You had a that's what primary care was for. And I think
Mhm.
minor ailments you were probably okay, like something
Sure,
that was
of
just
course.
nagging you, but nothing acute, fine, right? But yeah, like a lot of people went to their primary care physician for the sole reason of I need to go see the GI. I need to go see the rheumatologist. I need to go see someone else. And the only way to get to that someone else was to be referred by my primary care physician. So I think that function of primary care, you're absolutely right, is just bureaucracy for the sake of bureaucracy. It's just
Mhm.
why did we do that? Right. Like,
And I don't know the history of it, but my guess is the insurance companies didn't want to pay for the specialists if it wasn't needed. And so that's probably why it happened. It's something along those
could
lines.
be also, there could be, it was a lot harder to know those specialists way back when,
Mhm.
right? We didn't have provider directories like we do now. You couldn't search on the website and find out
Sure.
who's the local. So you had to go to someone who was in the know. And primary care, part of their job was to know, okay, who was it in the area that I can refer my patients to, right?
Yeah.
So, and so I think they did serve that function. But today, with technology, with provider directories, with a lot of the patient access tools like the ones from Kairos and others, it's so easy to find a specialist now, right? To your point, like what you do, you can just bypass the primary care physician if you wanted. And if they have online booking of appointments, there's an option for new patients, right? Just to go ahead and
Yep.
book.
And Dr. Google probably told you which specialist actually takes care of this issue.
Right. So I think it's true that part of the function of primary care in the past was like this, but now there's many other paths, right? There's urgent care, there's of course the ED, and then there's direct. You can just go direct to these specialists. But I think, the part where they're providing you wellness, I think that's very interesting because I think some smart uh, physicians are now building new practices around that aspect, right? Where they're
Yep.
building not just practices around, oh, I can bring a laboratory in. No, no, no. Now I'm bringing actually people who specialize in mental health, and I can bring people in who help with a physiotherapy, right? And that's become their practice. So it's much more around preventative and wellness as opposed to just coming in when you're sick and for that 6 month checkup.
Yep. No, that makes a lot of sense.
Yeah. So I mean, hopefully that's we're gonna see the rise of that kind of practice soon, or more so. Hey, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hung. Today, we're talking about primary care and whether the relationship with primary care is dead.
Do we need to build the coffin?
Yeah. I mean, you and I both know what comes around goes around, right? Like we'll be talking about the rise of primary care about 10 years from now. Right?
That's such a good point. I mean, I think that's what's interesting about it, right? I think we all know that primary care is really not dead, but it's going to transform in huge ways. And kind of a question that came up for me that I think is really interesting. And, this is kind of coming out of the health conference that I just attended in Boston. And primary care was prominent and the investments are happening and they're really looking at how do we transform primary care. One of the questions that came up to me was, can we have a relationship with an organization or even a company, or does it need to be with a person, with a doctor? Like, so could I have a primary care relationship with Amazon? Does that, is that possible, or not really? It needs to be a person. What do you think about that?
That's an interesting one because my mind went right away to, do you have a relationship with Netflix? Right? Like, do you feel that Netflix knows you well enough to make the good movie recommendations, right?
Well, I mean, they're kind of my on again, off again boyfriend or girlfriend, so like I cancel them and I turn them on and off. So I guess it kind of is a good example for primary care for me. But yeah, I mean, do we trust them to do recommendations? Ooh, that's interesting.
Yeah,
Yeah.
like so I guess my answer would be, I think in the past the answer would have been no way. There's no way I have a relationship with the practice itself. I have a relationship with a doctor at the practice. But I think as technology has gotten better, as the EHR has gotten more comprehensive and is now tracking years of my history, I actually could see where, you know what, it's okay. I can see Dr. A or Dr. B because all my information is right there and they have the access to the same stuff. And if Dr. B isn't the one I regularly see, but can see all this stuff and get up to speed quickly, then I'm comfortable going to that doc. I don't have to see Dr. A all the time, right?
Yep.
So I think as the technology has gotten better, I think it can be where you can have a relationship with an organization as opposed to the people inside. I still think it's a human connection. You have to have, a good connection with each of the docs maybe you're seeing, but I think it can be a little bit more abstracted back to the organization with better tech.
Yeah. And that's where it heads for me is Okay, well, I can't really have a relationship with the technology. I'll still have a relationship with the people, but does it need to be one person? I mean, I think that's what you kind of said, is that it could be multiple people that have all of the data, so that then I have a relationship there. I actually posed this question on Twitter, and Dr. Jay Parkinson, I think if I remember his name right, one of the pioneers in telehealth and direct primary care and all those things, he said something interesting. He said, I don't think you can have a relationship with a company, but you can with a service.
Mm.
So that was a subtle difference, right? So yeah, I'm not, deeply in love with Amazon, right? But I do have a relationship with ordering on Amazon and having it delivered and having that service there, right? That's a relationship in my life that improves my life. And so I think if we think about it that way, could we have a relationship with the right service that solves a problem for me over and over? I think the challenge is that healthcare is so dynamic that solving the problem over and over again is challenging to do at scale if we're talking primary care. In fact, that's why we see the direct primary care for the blue pill, right? The Rose of the world that say, okay, I just need to get my blue pill. Or, we're seeing it in the mental health space for many of the drugs for the mental health. There's like, I just need to refill my prescription. That's something that you can easily define and repeat. Whereas I think with primary care, it's a little harder. And so, how do you scale that service so that it's a relationship?
Well, and you hit on something there, or made me think of something. It, yes, I think we all want a relationship, ideally, with someone on the other side who's caring about us as individuals and cares about us being well and healthy. But in terms of going to see someone or going to see a company or an organization, I think it's more actually related to trust as opposed to
Mm.
relationship. So I feel I could trust CVS. I could trust a Walmart to provide me good care. And there, I don't know the individual doc who's on shift that day or not. I walk into a different Walmart, it's a completely different, but I trust that in the process that Walmart has gone through
Mm.
to select the doc,
They
right? And
vetted
to
them.
exactly like, so I think that that's possible. Much like how we have a relationship with Amazon, I trust that Amazon's stuff that they're shipping to me is not the cheapest, thing ever made. It's going to fall apart in 4 days, right? Like, I trust when the ratings are pretty high. I trust that it's a really good product. I think people can have that same level of trust with an organization that, okay, I trust the level of care that I'm getting, even though I don't have a relationship with a person in it.
Yeah. Well, and I think the other challenge is when I look at my experiences with primary care providers,
Mhm.
did they really act out of concern for me? Or did they act out of, okay, I'm going to address your chief complaint and I'm going to do that and move on? And, was I on the treadmill? So I think almost because of our reimbursement system, many of these primary care organizations cared about the chief complaint and they dealt with that fine. And that's what I was paying them for. And that's fine. But they didn't really care about me. And so I look at it and I say, okay, well, is there a better chance that your technology could actually make me feel like you care about me? Because the current health system with primary care doesn't make me feel that way. I feel like a cog in the system. And so, could this technology scale to the problem? Because I mean, that's, I think, part of the reality is there's not enough primary care people. They don't have enough time in a visit. And so they aren't able to do it. I don't blame them for it, right?
Sure.
But could technology scale to that problem where the doctor can and the technology together could make me feel like that company or that service actually cared about me? I think that's actually more possible than where we are today, where many of the doctors, when you leave that room, they don't care about you anymore. I mean, they're human, maybe they do care, but you know what I mean.
Yeah. No, but and I think you're hitting on something there. I think some of the technologies already exist today that can help with that, right? Much like, I hate the comparison, but much like when you bring your car to the car dealership, right, and then you get the text, 3 hours after you leave, you go, hey, how was this? How was the service? Is anything wrong? Can we help you? Anything? Press here, right, to connect back to your service manager, right? If something is wrong with your car, then you get the follow up a week later. I think there are technologies, obviously, that a primary care organization could bring to bear that are like that, right? That check in with patients, and we know we've seen them at conferences where, if you have a condition, it'll ping you, right, or ask you for the latest information and upload it to the EMR or to the EHR. Like there are technologies that can help with some of the mechanics of that relationship, but actually caring, I'm not sure yet. I don't think AI has gotten to the point where you're gonna feel like, oh, like this person really cares about me if some automated system is connecting with me.
But that's the problem, is we've done such a poor job of caring, and it starts right in the first step into the waiting room when they hand you a form and say, fill this out again. Like that's the epitome of I don't care about you, right? Like
Right.
you filled this out 6 times and guess what? You get to do it again, right? I mean, like that's the epitome of what I'm talking about. And so like the bar is not very high for a company to say, oh yeah, we actually care about you. And to be honest, there are organizations that are doing this much better. And there are, let me make clear, there's a lot of doctors that truly do care about their
Sure.
patients and go above and beyond, but the system is not why they care. In fact, they have to fight against the system to actually show care in many cases. And that's the unfortunate part. And then what's interesting now is we're seeing incredible investment in this area. I mean, the amount of dollars that's flowing into primary care is just incredible. There's so many startups in this area. And so I look at that and I say, well, will they be successful? One that was really interesting to me was Oak Street Health that I talked with at the HLTH conference, the health conference.
Mm-hmm.
And they are focused on Medicare, primary care, and underserved areas. And it's just a fascinating niche. And, obviously that's pretty much all over the country. So they can scale to the whole country. They don't need to
Right.
even go to Medicaid or other populations like that. But it's like they're providing true primary care. For example, they said that during the visit or scheduling of the visit, they say, do you need transportation? Because they have value-based arrangements with all of their organizations with Medicare Advantage plans, they can offer that because it's really important that that person be seen, whether they have transportation or not. So I think that's interesting. And to me, that's going to be really successful. I think that's an example of a primary care startup that could be extremely successful.
Yeah, and you were saying that before we got on air here, John, that you just saw a ton of companies at HLTH that were in this zone in primary care, which was frankly very fascinating to me that there is so much investment happening in this space, especially when we know that there are the big push from the folks like Amazon and Walmart into this space, right? You'd think that people would be like abandoning the space, like like there's no tomorrow, because once those competitors got in, what else is there left, right? Like what's going to be remaining? But I think to your point earlier, it's been ignored for so long, right? There's so much room for improvement. The docs themselves are clamoring for, hey, like help me fix this, because I do want to spend more time with my patients. I do want to care about those that are in my community. Help me find some ways to get back to that.
Yeah.
And yeah, so it's encouraging. I'm encouraged by the number of investments and amount of investments that's happening. And it's not all in technology, right? Like there's a lot of startups who are really kind of trying new models of care. Like it was a company that the CEO was on one of the panels, the City Block Health, right? That's a
Uh-huh.
community-based healthcare organization that's really kind of trying to change the dynamics and getting people from the community to take care of people in the community, right? And then mixing in social workers, therapists, and so it's not your typical practice. To me, that's innovation, right? It's not a classic tech startup by any means, but it's definitely a startup in the sense of they're really kind of changing and innovating the way primary care is delivered. So definitely very excited to see all this stuff happen.
Yeah, there was a really interesting tiff that happened at one of the sessions between I think he was CEO of Forward and then the One Medical, which acquired Iora Health, right? And two big players, making a lot of noise in the primary care space, right? And the Forward CEO pointed out, you're part of the problem. You're just exacerbating the problem. You're not really innovating on this. And, his feeling was we need technology to be a major solution to the problems of healthcare, the costs of healthcare. And he was really pushing that forward. And of course, one medical, fought back and said, yeah, technology is core to us as well. And I mean, there was an interesting banter. You can check out the full session. But what's interesting is that the investors see this opportunity. They see that primary care is going to matter more in a value-based care world.
Right.
And so that's the problem with the current system. The current system doesn't go to value-based care. And so I think we do probably need primary care in some form or fashion. The question is it going to be a technology solution? Is it going to be a human? Is it going to be a mix of the two? And how are we going to get there? But that to do value-based care takes more than just us going to Dr. Google. It takes primary care that cares about us and keeps us healthy more than what we do today.
Yeah, and I totally agree with you. I think what we're seeing, or we've seen up until this point in terms of classic primary care, is going away. I think, there's not a lot of money in it. Second of all, the lifestyles of people have changed where, do I really need to see a doc every 6 months if I'm healthy, right?
Mm-hmm.
And when I do have an acute need, can they really help me anyway? Am I going to the ED anyways, or the urgent care center? So I think the dynamics of how we use primary care have changed. And I think as we're seeing with City Block Health and others that you've mentioned, John, like, I think we're starting to see that shift. Like, oh, okay, like I need to be more proactive here. I need to really care about wellness. I can't just be the place they come and see me every 6 months, right? And so I think that's the future of primary care. And then you kind of look at some technology even further and go, well, do you even need to come in, right? Is this all virtual? Right? Sure. I can do the check-in with you, and yeah, if you need a script and that's all you need, okay, we can do that remote now too. I don't have to have you come in.
It's kind of an archaic idea. Oh, let's check you every 6 months, as if stuff happens every 6 months, or your annual wellness check, right? Like, okay, we were doing the best with what we have, but in this technology world of, constant health monitoring, and the wearables could track anything, like that idea is like so old school that you're like, why would I do that? Shouldn't you be monitoring me all the time?
Exactly.
And
that's
Fitbit, where it's headed.
My Fitbit knows me better than you do, right? Like, because it's tracking me daily.
Yeah, so. Exactly. And so I think that's where we see these organizations heading, which is, how do we do this on a relationship basis? So it's interesting to come full circle to the relationship, but how do we create an ongoing relationship? And unfortunately, we can't do that in our current system. The people just don't scale to that problem. We have to use technology. Now, how we get there, that's going to be fun to watch.
Well, I can't think of a better way to end this episode, John. So thanks to all of you who tuned into this episode of Healthcare IT Today. For more details about our show, check out the programs page on healthcarenowradio.com. And please share your voice and engage with the community at healthcareittoday.com and on Twitter using the hashtag HITSM. I'm Colin Hung, along with my friend and health IT collaborator, John Lamb. Thanks for listening. Have a great week.